Hello, this is my course comprehension PowerPoint. I'm Alexandria Avila. This is for CSDO 352 for Professor Katie Pitts, and today is February 24th, 2024. The PTA frequency is 51.7 decibels in the right ear and 71.7 decibels in the left ear. So the Miss S does have normal to severe sensory neural hearing loss in the right ear and normal to mild sensory neural hearing loss in the left ear. The results are consistent for the right ear because of the reports of tinnitus as well as aural fullness. The audiometric findings show both ears have significant hearing loss, which shows why the patient is having some complaints. Based on the Sprint chart, the WRS for the right ear is 64% at 50 decibels, and for the left ear, the WRS is at 88% at 50 decibels. So the right ear is not really as expected because of the degree, but the left ear is. The word recognition is better in the left ear rather than the right ear. The type of tympanogram results that I would expect to see would be type A, because there's no visible abnormalities in the middle ear. That was for the right ear. And for the left ear, I would expect either type AS or AD because of the aural fullness. So there might be some stiffness in the ear. Looking at the information the patient gives, this is related to age-related sensory neural hearing loss, as well as increasing tinnitus in the right ear, and as well as aural fullness. So in this reflection, we can see that my adult patient asks, what is the difference between purchasing hearing aids through my office versus purchasing hearing aids from a person who tested their hearing at Costco last week? So I do want to explain that there are two different professionals that deal with the hearing healthcare. So one is an audiologist and the other is a hearing instrument specialist. So I do want to explain that an audiologist evaluates the patients as well as diagnoses them, while a hearing instrument specialist, also known as an HIS, is the one who is mainly providing the instrument. Like, yes, they do tests on you as well. They perform the hearing test, but they don't go too much into detail. So an audiologist does have to have a master's or doctorates, while a hearing instrument specialist just needs a high school diploma and, of course, a certification. So like I stated before, they both perform hearing tests, but the audiologist does have the knowledge of hearing science. So I would explain to them I do know more about the different hearing disorders. I'm going more into detail with their hearing loss, while maybe someone who sells them the hearing aids at Costco is just giving them the basics. So yes, it may be less expensive buying the hearing aids at Costco, but as their audiologist, I know what is best for them and which hearing aid will work best as well. I would first explain to mom and dad that we understand that baby was diagnosed with severe to profound hearing and that there are different communication methods that we would like to explain to them. So I would first explain to them that a cochlear implant would be very helpful, but this would have to wait a few more months, but this can get the baby to be able to hear later on in life. I would also tell them that the implant will help baby hear as well as help the baby speak when they get older. So a communication method that can be used for both parent and child is by using sign language. So sign language is a good start off to be able to speak with their child. So this method is effective because many people know sign language, and once learned, it will be easy to communicate with their child, as well as it will be easy to process the information that is being given out either by mom, dad, or baby. So the child will be able to communicate and express themselves when doing the sign language. So another communication method I would tell mom and dad about would be by doing gestures. Gestures is another communication method that can help when doing like asking for more food, asking for a hug, waving bye, waving hello. So, and I do recommend doing the gestures with sign language because it can be more effective like that as well. So in this reflection, we can see that Marnie has post-meningitic hearing loss. Her hearing, of course, has improved and is stabilized with the hearing aids. So she has purchased through a private practice of an audiologist's office, which is appropriate for the loss that Marnie has. So Marnie's mom is worried that other kids will tease her because of the hearing aids. And Marnie's mom is trying to make it seem that Marnie can hear pretty well without the hearing aids. But we do need her to wear them so that she is benefiting from them. And I can understand where mom is saying that she's scared that maybe kids at Marnie's school will tease her, but she will be benefiting from the hearing aids in the long run. So the issue that Marnie's mom is showing is that mom thinks Marnie can understand her pretty well without them, but we do need Marnie hearing perfectly fine, which is what she does with the hearing aids. She can hear fine with the hearing aids, which is why her hearing has improved and stabilized. So after looking at Marnie's chart, it does show hearing loss, and of course it has improved because of the hearing aids. Mom does need to understand that the hearing aids help Marnie and she needs to wear them. So some approaches to help mom understand that Marnie needs them is by telling mom how Marnie may feel. So she may feel the different disadvantages that she may have, like how other kids can hear and she can't without the hearing aids. As well as trying to talk to people without them. It will be harder for Marnie to understand and speak to others. So an approach for getting kids to not tease is maybe talking to Marnie's teacher or explaining to Marnie that some kids may just be curious, but if they are being mean, to let teacher know. It is important that Marnie knows that she is able to go to her teacher when someone is bullying her. Marnie also, mom states that Marnie is such a pretty girl. So I'm thinking she is saying she's a pretty girl without them. But Marnie will be pretty whether she has or doesn't have the hearing aids, is what I would also let mom know. As we can see in this reflection, the patient is having a hard time understanding that he may be having some hearing loss. The wife even thinks that he may have a hearing problem. He does deny dizziness and oral fullness, but he does state that he wishes people spoke as clearly as they once did, meaning he is not hearing the people the same as he used to. So the patient didn't hear his name when he was being called in the waiting room, which is a little sign that he may be having some hearing loss. He even said, huh, in a time or two in the interview. So I would let the patient know what I noticed, like how he didn't hear when he was being called, or how he was not being able to hear when answering some of the questions in the interview. So he also stated that people tend to mumble these days, meaning he's not able to hear as well as he could before. To help the patient accept that he may be losing some of the hearing is by letting him know that it is normal at his age and that there are treatments and therapy for hearing loss. He may feel denial and doesn't want to accept his hearing loss, but it is important to let him know that I am there to help. I would ask him questions on how he feels and discuss different devices that will help. So, for example, I would ask him, why doesn't he think he has hearing loss? Or why does his wife think he does have hearing loss as well? I would also see which device or option would make him feel more comfortable so that he can get a little acceptance of the hearing loss.